We're back for your ears only. I'm Melissa Axelberth.
I'm David Alpern with this quote from the news. She was the bravest woman I have ever known. That was Maggie O'Kane on Marie Colvin, the veteran war correspondent killed in Syria last week at age 56. Known for her tenacity and dedication to depicting the pain of innocent victims and the evil of injustice, Colvin wore a trademark eye patch after losing her left eye to shrapnel in 2001 in Sri Lanka. Now this.
I think there are some stories that are worth taking risks for. Unless you're there covering it, no one is going to know about it.
Like many of the world's top war correspondents, two-time Pulitzer Prize winner Anthony Shadid knew risk. The 43-year-old journalist was shot in Ramallah and kidnapped in Libya. But when he died in Syria 2 weeks ago, it wasn't from the brutal shelling about which we talked earlier in the show, but from an extreme asthma attack, probably brought on by proximity to the horses that were secretly carrying him and his colleagues out of the country. In those last critical moments, Shadid was also one of 34 million Americans afflicted with the disease, and one of 3,600 who die from it annually, in many cases unnecessarily.
In the wake of Shadid's untimely death, there was new attention last week to an earlier study suggesting that the common over-the-counter medication acetaminophen, an active ingredient in Tylenol and many cold and cough products such as NyQuil and Theraflu, may make asthma worse, especially in children who have the condition. Last week, too, a new study from Boston Children's Hospital found some relatively simple and inexpensive steps were highly effective in helping the youngest asthma victims. To talk more about that research for your ears only, we have the author of the report, Dr. Elizabeth Woods. She's Associate Chief in the Division of Adolescent Young Adult Medicine at Boston Children's Hospital and Professor of Pediatrics at Harvard Medical School. Welcome to the program.
Thank you very much.
First, remind us exactly what asthma is, the major physical symptoms.
Well, first off, I want to say how sobering the introduction that you and Melissa had around the death of Anthony Shadid to remind us how serious asthma can be and that people can die from the symptoms. In terms of the symptoms that most patients feel or have, they reflect irritable airways and inflammation in the airways, and they get symptoms such as wheezing, cough, shortness of breath, tightness of the chest in response to viral illnesses or allergens.
What do we know about their cause? Genetic, environmental?
There's probably multiple contributions to the cause of asthma, and many of those hypotheses and areas that people are posing are being researched right now, and they are being investigated by allergy immunologists, pulmonologists, and other specialists.
When was your program, the Community Asthma Initiative, launched?
The Community Asthma Initiative was launched on October 1st, 2005, after a 2-year planning period working with community members, community partners, and families in the area close to Children's Hospital.
Tell us about the children who were chosen for the hospital's program. How many, from where, in terms of neighborhoods, social, and economic status?
So the first pilot stage of the program, as described in the paper in Pediatrics, was addressing children who had had a previous hospitalization or emergency room visit from 4 zip codes, which were very close neighbors of Children's Hospital.
And when community healthcare workers were sent to these children's homes, what were they most surprised to find?
There were 2 main areas that we found we need to help families with, and we're maybe surprised that we need to put so much effort in to help them. The first was to help families understand asthma and asthma medications and the need for medications long term, not just at the time for exacerbation. The second area of assistance was with environmental issues. 71% of the families had household incomes of less than $25,000, as it turned out, and were often in housing that was public housing or low-income housing that had some challenges in terms of dust, mold, pests, including cockroaches and mice, that could trigger their child's asthma.
What measures did they try to have each household take?
So we worked within each household and tailored the intervention to what they needed. We did find that pretty much all the families needed HEPA vacuum cleaners and bedding and casings.
Explain that. What does HEPA mean?
HEPA is has low pour filters in it so that the particles are filtered out.
It's not a brand name, but a classification
it's
vacuum.
It's a classification, right? And it's particularly of the filter and the bags in the vacuum.
After
and
the first,
so the
ahead.
intervention was tailored to the needs of the family, but universally we gave HEPA-filtered vacuums and bedding casings, and then depending on what the issues were within the unit, we helped address them.
After the first year the program was in effect, what were the results in terms of the kids' health, attacks, emergency room visits?
So that was what was quite remarkable and highly significant, is that we provide services primarily in the first year after a hospitalization or emergency department visit, and that if you compare to the previous year, there was an 85% reduction in hospitalizations and a 68% reduction in emergency department visits.
What about missed school days for kids and work days for parents taking care of them?
So in that area, there was also additional improvement, and in this project, we measured any of these events, not just the number of days, but the percent reduction in terms of children or families having any days or events. So in terms of, there was a 42% reduction in limitation of days with physical activity limitation, and 41% reduction in patients having any missed school days, and almost 50% reduction in parents or guardians having any missed work days due to asthma.
And in terms of dollars, what was the savings on medical costs for children in the program compared to those who were not in the program?
So the most important take-home message in terms of costs was that for every dollar spent on the program, $1.46 was saved in terms of hospitalizations and emergency room costs to society and insurers. So there was for what you spent on the program, you saved almost $1.50 in terms of expenses to society.
Dr. Elizabeth Woods is Associate Chief in the Division of Adolescent Young Adult Medicine at Boston Children's Hospital and Professor of Pediatrics at Harvard Medical School.
Quote from the news, "Ordinary Americans can do extraordinary things." That was President Obama on the message of a new National Museum of African American History and Culture scheduled to open in 2015 as ground was broken for it last week on the Washington Mall.
Next, what is love for your ears only?